Shut off, Mahin. Hello, everybody. Sorry to be a few minutes late. Could someone tell me, are these going to be on without an ability to shut? Okay. Just, I think going forward, we want to have the ability, if we can, to be able to shut these off by ourselves. Say that one more time. Okay. Should we wait or just go ahead? Does that mean go? Okay. Again, sorry to be a few minutes late. Good afternoon, everybody. As you can see, we've moved venues because we want to practice what we preach, and that is giving you all enough personal space, but also giving ourselves up here enough personal space. So I don't want anyone to think that I've had a falling out with Assistant Commissioner of Health, Chris Newworth. Chris is with us on stage right, and he's available for any questions that you may have. Honored to be joined. And by the way, Sheila Oliver, I want to give a big shout out to. She and I determined overnight that we're probably better to divide and conquer. And we have a lot of balls in the air, as you can imagine. So she sends her best wishes, and I want to give her a huge shout out in absentia. Up on the dais with me to my right, again, the woman who needs no introduction, our Health Commissioner, Judith Persichilli. To her right, our state's epidemiologist, Dr. Christina Tan. To my immediate left, the Hackensack Meridian Health CEO and dear friend, Bob Garrett. Bob, great to have you with us. And to his left, again, another man who needs no introduction, the Superintendent of the State Police, Colonel Pat Callahan. So to Judy, who herself is an Italian-American and whose late husband, Tony, was an Italian-American, I want to say to you and all the Italian Americans up and down the great state of New Jersey, happy St. Joseph's Day. This is a big day in the Italian American calendar every year, and I want to give a shout out to all of our Italian American brothers and sisters up and down the state. So several things. Oh, by the way, I'm sorry, I forgot. I skipped over an important player here today, and I apologize. Our Secretary of State, Tahisha Way, is in the house. Tahisha, thank you so much for joining us. And there's a particular reason why you're here, as you know, but I apologize for that, and it's great to have you. So a couple of things. Number one, I had a conference call yesterday afternoon, as I think I had said yesterday that I would, with leaders in our healthcare systems, both CEOs and labor representatives, and I expressed, among other things, to them our gratitude for their continued hard work and selflessness. We know this crisis is putting an enormous strain on their resources, and we're all working together to make sure that our frontline health responders have what they need to not only save lives, but to keep safe themselves. So Bob, as one of the leaders of one of our biggest systems, I greatly appreciate your time to be here to give us today a much needed perspective. And we had a really good back and forth discussion. Topics that came up, consistent approach to things like training and equipment across all of our health systems. In fact, there's a working group that came out of the call yesterday to make sure there was that consistency. Access to equipment, daycare, which has become a big item, other sources of anxiety. And I don't know where we would be without our healthcare systems and without our healthcare workers right now. I separately had a call with representatives of up from up and down the state, representatives of our educator community, and just walk through the rationale that we had applied to closing of the public and private schools in the state, some of the thought that went into that, some of the things that we're looking at in terms of execution of that plan, particularly, as I've mentioned many times, to those who have food insecurity, to those questions related to remote learning, daycare, etc. And I also asked the educators, as I have asked in each of these sessions, to make sure our young people realize that they're not immune, that they themselves, and I think sadly, Judy, if I'm not wrong, and Christina, the data shows around the world that young people are getting a little bit more sick from this than had been the case a week or two ago. But even more importantly, even if you're a picture of health, you could unwittingly pass this to an older generation member, and including in your family. So we had a good call. I also previewed yesterday, our Director of the Office of Homeland Security, Jared Maples, is here. I previewed yesterday that Jared would chair an Interfaith Advisory Council call this morning. I'm happy to say that took place, and I think it was a wild success in terms of sort of going through our approach, answering questions. And again, I want to thank you. It's got 3,500 members. Any idea how many were on the call? Several hundred were on the call, which is higher than, which is a nice hit rate from up and down the state. I also want to acknowledge that Dan Kelly is here from my office, who is responsible for emergency preparedness and response. Dan will join me and others, Pat Callahan, I assume Jared and Judy and others later today at the Rock, first for a VTC with at least the Vice President, perhaps the President and their teams, to get an update from the White House, and then immediately after that, an in-person meeting with the leadership of the Army Corps of Engineers. So thank you in advance for that. As I mentioned, for the reason that Secretary Tahisha Way is with us, I've just signed an executive order pertaining to upcoming elections and ensuring that our democratic process works throughout this crisis, which I'll outline in a moment, and I know Tahisha will add some detail to that. So, first, since yesterday, we have received 318 new positive test results, 6 of those through the DOH labs and the other 312 through our private sector and healthcare provider networks. Our statewide total is 742. If you added yesterday's to 318, you might get a different number, and that's just going to be the case, folks. We're going to have duplicates. We're going to have folks who may have been out-of-staters who got tested in New Jersey. For whatever reason, the official number is now 742. Those numbers will be released as soon as they're available. As I said to you yesterday, because of the VTC that we have with the White House, we're doing this press gathering earlier in the day, which means it's a little bit more of a scramble for Judy and her team to get the right numbers, although we've got them. She'll go through those numbers by counties. Let me just say as clearly as I can, we have expected these numbers. As you combine a reality of at least some community spread with an aggressive expansion of testing, more on that later, we knew the number of positive results would go up. And I will tell you right now, as I sit here on March 19th, I guess, these numbers will, I am certain, sooner than later, go into the many thousands. And I want to make sure folks out there listening today, as we've said all along, we expect that to happen. We expect it to happen for a couple of reasons, as I mentioned already, some amount of community spread, and I'll let the experts address that. And then separately, we are aggressively expanding testing. A lot more people will get tests at Hackensack, in the private, in the drive-thrus, which we'll talk about in a minute. In other locations, we have believed since day one, and this goes back to conversations our team had in January, and then we established our statewide task force, whole of government task force on February 2nd. We have believed that the extent to which we could get the equipment, the personnel, the PPE, in addition to the swabs, and we had testing capacity, we were completely supportive and remain completely supportive of folks getting tested. And Judy will get into this. Folks with symptoms are the highest priority, and within that group, healthcare workers are the even higher priority, and we'll get to that, and Judy will get to that in a few moments. So folks, we expected this. These numbers are going to go up. They're going to go up, one person's opinion, into the many thousands. Again, we are doing everything we can to break the back of that curve, flatten it, spread this out, take pressure off the healthcare system as a result, save lives as a result. And by the way, by the insurance policy, as we're doing with the Army Corps of Engineers, expand our capacity on the healthcare side, assuming we need that maybe perhaps in advance of our success in flattening the curve. So I want there to be no doubt about this. There are sadly 4 additional fatalities that we can report, bringing the total to date to 9. And Commissioner Persichilli will have details on those individuals, and I join her and all of us in sending our deepest condolences to their families. There are multiple testing locations currently and opening across the state, and again, Judy and her team can speak to these, particularly the opening tomorrow up in Bergen County. We anticipate, speaking of which, the FEMA-backed testing location at Bergen County College will be up and running, Chris, tomorrow. We good to go? And I plan to visit this site, and our daily briefing tomorrow, in fact, will be held at Bergen County College. And more details on that in a moment. Additionally, I am ordering effective 8 p.m. tonight the closure of all personal care businesses which cannot comply with social distancing guidelines. That includes barbershops and hair salons, spas, nail and eyelash salons, tattoo parlors, among others, and social clubs until further notice. Again, those will be closed this evening beginning at 8 p.m. We are as aggressive as any American state in the steps that we've taken, bless you, but we reserve the right, as I've just announced, to each and every day, if not each and every hour, to revisit the steps we've taken and to assess, at least at this point, whether or not we should take further steps. So watch that space. Now, as I mentioned, I've signed an executive order unrelated to what I just said, although related in the bigger sense, an executive order regarding upcoming elections. Under this order, in addition to in-person submission of candidate petitions, the Secretary of State will allow candidate petitions to be submitted electronically. The Secretary of State's office will also be creating an online petition form through which voters may submit signatures for candidate petitions by the March 30th deadline. And again, Tahisha, tell me if I'm wrong, but the operative website is elections.nj.gov.
That is correct.
And you'll hear from Tahisha in a few moments. Let me be clear, the March 30 petition deadline remains intact, and this online platform will be shared with county and municipal clerks. No one, however, no one should be out gathering signatures physically. We want to see all signature collection moving to the online platforms that will be opened. Candidates with already completed petition forms should turn those in by March 30th. Those will count. And now they should be focusing completely and exclusively on collecting any remaining signatures online. As for the elections themselves, the March 21st special election in the Fire District of Old Bridge, the March 31st special elections in both Atlantic City and West Amwell Township, and all April 21st school elections, all of those elections I've just mentioned will be moved to Tuesday, May 12th, the same day as regularly scheduled nonpartisan municipal elections. Additionally, these elections specifically, will all be conducted through vote by mail only. Again, let me repeat this. The March 21st special election in the Fire District of Old Bridge, the March 31st special elections in both Atlantic City and West Amwell Township, and all of the April 21st school elections will be moved to Tuesday, May 12th, the same day as the regularly scheduled nonpartisan municipal elections, and all of the above will be conducted through vote by mail only. At this time, there are no changes being announced for our scheduled June 2nd primary elections, aside from the changes to the petition procedures I just announced. However, we will not hesitate to act if this emergency requires us to do so. Again, at this moment, no changes to the June 2nd elections. There is no greater right in a democracy than the right to vote. Over the years, people have quite literally given their lives for their right to vote. But given the current emergency, we want to make sure everyone is safe in voting. And as I mentioned, I will ask Secretary Way in a few moments to speak to her office's efforts on this. As we know, as you likely know, the state Senate is in session today working on legislation aimed at aiding our emergency response. We intend to swiftly review these bills as we have and are doing as it relates to what's come to us from the Assembly as they come to us. I thank explicitly Senate President Steve Sweeney and Speaker Craig Coughlin and their members for their partnership and their efforts in this historic time in our state's and nation's history. One of these measures would give the governor the explicit authority through executive order to suspend the removal of individuals pursuant to foreclosures or eviction proceedings. So I will depart from my norm of not commenting on bills that have not yet come to my desk and say that I will be signing both this bill the moment it comes to my desk this afternoon and moments later an executive order pursuant to this law that will immediately suspend all removal of individuals as a result of evictions or foreclosures. And in doing so, New Jersey's residents and families will have protections as expansive as any state in the United States. No one, and I repeat, no one in New Jersey should fear being kicked out of their home in this emergency. These actions come on the heels of yesterday's announcements by the Federal Department of Housing and Urban Development that it is suspending all evictions and foreclosures on HUD-backed properties for 60 days, and by both Fannie Mae and Freddie Mac that they are suspending all foreclosures and evictions for at least 60 days for their mortgage holders. Along these same lines, I will reiterate my words from Tuesday and urge in the strongest possible terms banks and lenders to do what they can for their mortgage customers to make loan repayment much more flexible in the coming weeks and months. We simply cannot have families already anxious over their health, anxious about whether they're going to lose a roof over their heads. I and we are particularly cognizant of the very real economic anxiety being felt by workers in the hardest hit sectors, those who work by the hour, or those who are working in the gig economy. Last night, Dan Kelly in particular, received word that the Small Business Administration had approved our application for small businesses to apply for federal disaster loans. Now, Dan oversaw our state's response to Superstorm Sandy, so this is not abstract for Dan and his team. They have lived this, so this caution comes from experience. This is certainly good news, but, and this is a but, I would urge all but the hardest hit businesses, those who are facing literally life and death decisions right now, to take a step back if at all possible. This is actually a lesson we learned in the wake of Superstorm Sandy when homeowners and small businesses were pushed to apply for disaster loans only to learn later that they could have been eligible for grants that were made available later on. We are going to fight alongside our federal delegation, and they are doing an extraordinary job, by the way, and those from our neighboring states. And again, the more strength we have in terms of numbers, the higher the likelihood we will get success in some of the big asks we have. We're going to continue to fight for stimulus packages that include small business grants, and in that we will fight to ensure that any loans provided now could be paid down by grant funds later on. If anybody's got in particular questions after we break today, Dan Kelly's your man off to stage left. As I said, Tuesday, we hope to be able to stand up a state business assistance program shortly. The Economic Development Authority is able to help guide small businesses in making these decisions. And I encourage any business owners with questions to go to the New Jersey Business Action Center's COVID-19 information page, which is cv.business.nj.gov, cv.business.nj.gov. I also want to say that our economics team and the Economic Development Authority are working on what I would call a Jobs NJ, which we announced earlier this year as an initiative to better marry and more seamlessly employers with employees. They're actually working on an emergency COVID-19 version of Jobs NJ in the sort of here and now. What's available? Who's out of work? And we got a lot of folks out of work, and those numbers are going up and not down. How can we best and most quickly match those two communities? I started
banging the table yesterday, and I want to reiterate that we're in conversations with our neighboring states, in particular New York, Connecticut, Pennsylvania, to make an explicit multi-state plea with the administration, beginning with the president, as well as the leadership in Congress, for a massive block grant program. So if you're a state like ours right now, where you've got enormous devastation in the worker community, in the small business community, New Jersey is at the front lines doing everything we can. But the meter is running, and it's running in a big way. We need back and fill from the federal government. No one state, never mind New Jersey, has enough money to continue to do what we're doing. So I want to pound the table that the best, most effective, quickest way we can stay in the game for our workers, for our small businesses, is to get federal block grants, which requires Congress to pass that and for a president to sign it. You know, we were doing some math last night. We think across the states of New Jersey, Pennsylvania, New York, Connecticut, what's that number look like? I think it's at least 100 billion with a B US dollars. But that's the best money any state can get right now, because it allows us to stay right at the point of attack, not worry about the back end meter that is running right now in New Jersey, but to be there for our people and our businesses. I also want to add that NJ Transit just submitted a letter to our congressional delegation with a very crisp estimate of the huge shortfall they will be facing between now and I think they went out to the end of fiscal 2021, and that number is $1.25 billion for NJ Transit alone. So these are initiatives that you should assume we will continue to be quite aggressive on. I want to close with a few words before I turn things over to Judy, a few words to the people of New Jersey. First, again, if you have questions, you got a couple of different places to go. You can go to 211, which is up and running. You can go to 1-800-962-1253 or visit nj.gov/health. 211-1-800-962-1253 or nj.gov/health. To receive updates by text, please text NJ COVID to 898-211. And if you need live assistance, text your zip code to 898-211. Again, that's NJ COVID to 898-211 if you want to get updates. And if you need live assistance in the here and now, text your zip code to 898-211. Additionally, I urge residents not to hoard food or other supplies and to resist the urge to overcrowd grocery stores. I know the anxiety you feel and we feel. We understand it. When you see news reports showing emptying shelves, when you look at numbers of folks testing positive, but we are closely monitoring, in fact, aggressively monitoring the supply chain. We are confident in the ability of food and other grocery items to get to store shelves in a timely manner. To everybody, we deeply appreciate the cooperation we are seeing with our efforts to promote social distancing. I know it's not easy to be cooped up in a house, but this is what we all need to do to get through this together, and we will get through this together. And I repeat, especially to our younger residents, we're seeing that more and more of you are not immune. Everything we say and urge applies to you as well, both for your own health as well as for the potential of your passing on unknowingly, unwittingly, the virus to someone in an older generation. I cannot say it enough. We are one family. We don't always agree, but we always look out for each other. I also, again, tip my hat in particular to everybody who's working on the front lines of our responses. Regardless of the job you do, you're doing an incredible job. We cannot make it through this without your selfless efforts. I ask everyone to stay safe, to keep doing the basics, washing hands for 20 seconds with soap and water, coughing or sneezing into your sleeve. Don't touch your face. If you don't feel well, stay home. Frankly, we want everybody staying home at this point. We will flatten this curve together, and we will emerge stronger than ever before. Remember the two to the hip bone and the thigh bone here, right? Over here, we're cracking the back of the curve, flattening that curve, doing everything we can to isolate ourselves. You heard me take more steps today, and we reserved the right to take even more steps. And we mean it, by the way. We will enforce these steps. In fact, I have a statewide conference call tomorrow at noon with the Attorney General and law enforcement up and down the state as we go into a weekend. We mean business. When we say no more gatherings over X people, when we say this is closed, that you can't do this, we mean it and we will enforce it. The reason is so that we can take the pressure off over here, the healthcare system, and God willing, as a result, save lives and keep more people healthy. But again, this is an and both effort. We are doing everything over here, but we're not meeting with the Army Corps of Engineers for fun. This is, Judy will tell you, we are aggressively pursuing more capacity over here, just in case the timing of these two actions don't sync up as nicely as we would like or we would hope. Again, I say this unequivocally. If each of us does our job, beginning with yours truly, there is no doubt in my mind, not unscathed, not without mistake, but we will get through this together, stronger than ever before. With that, please help me welcome the Commissioner of the Department of Health, Judy Persichilli. Happy St. Joseph's Day.
Thank you, Governor. Good afternoon. Excuse me. As I'm sure you know, the CDC released preliminary data on the U.S. cases yesterday, and it provides insight into COVID-19 and how it's affecting our population here in our country. It demonstrates that risk for serious disease and death of COVID-19 among people in the U.S. increases with age, not surprisingly. However, it also indicates severe illness leading to hospitalization, including intensive care unit admissions and death, can occur in adults of any age. This data did reinforce that most of the serious outcomes occurred among adults 65 and older, with them having hospitalizations of about 45%, 53% ICU admissions, 80% of the deaths occurred among this population. So this information is similar to what was seen in China, indicating that more than 80% of deaths occurred among people 60 years and older. In contrast, individuals 19 and younger appear to have milder COVID-19 illness, with almost no hospitalizations or deaths. That's 19 years and younger. In New Jersey, we're still examining the data, and similar to the national trend, information on outcomes is somewhat limited at this time. The median age for our cases is a little bit younger. It's 52. Of the 139 cases for which we have outcome data, nearly half of them have been hospitalized. So although the median age of our cases is younger than those in the highest risk category, we are still very much focused on those individuals 60 years and older. I've spoken repeatedly about our concern for individuals who reside in long-term care facilities, especially our nursing homes. On March 6th, I held a conference call with more than 400 facilities to discuss about the COVID-19 preparedness for this vulnerable population. Last week, we sent guidance requiring them to restrict all visitors and also screen all staff as they enter the facility, and all medical staff professionals, including physicians, physical therapists, hospice workers. They were to be screened and are being screened for respiratory virus symptoms, contact with COVID-19 cases, and travel to any of the impacted countries or where community-based spread is occurring. We've also sent information to them on how to handle positive COVID-19 cases in long-term care settings. The department has identified positive cases of COVID-19 in 6 nursing home assisted living facilities. Last night, I ordered curtailing admissions, all admissions to those facilities. In addition, we're requiring them to use infection preventionists to assess their infection control practices, and they must conduct thorough cleaning, not only daily, but frequently during the day. We checked the screening of all of their employees, and every visitor that comes into, every vendor, I should say, that is dropping off or coming past the front doors of their facilities. We understand that these vulnerable individuals require protection. We also understand that the healthcare workers in these facilities are under a significant amount of strain right now due to the presence of COVID-19 amongst them. We're working to make sure that the symptomatic residents get tested, isolated, quarantined within the facilities, cohorted, you'll hear all of those words, and that every individual long-term care facility is taking the precautions necessary. On another note, I want you to know that tomorrow the testing site at Bergen County Community College will open. Individuals experiencing respiratory illness symptoms such as cough, fever, shortness of breath are eligible for testing. If the individuals don't have respiratory illness, they will not be tested tomorrow. So individuals should also bring proof of New Jersey residency with them. This site has the capacity to collect 2,500 specimens a week. As the governor shared, today we're reporting 4 new deaths in the state for a total of 9 deaths. Monmouth County, female in her 70s, and Ocean County male in his 70s. An Essex County male in his 60s, and a Bergen County male in his 30s. Today we're also announcing 318 new cases for a total of 742 cases in New Jersey. In the total of 9 deaths, we have confirmed that 3 appear to be associated with a long-term care facility. The 318 new cases are Bergen, 80, Burlington, 4, Camden, 6, Cape May, 1, Essex, 17, Gloucester, 1, Hudson, 20, Hunterdon, 2, Mercer, 5, Middlesex, 20, Monmouth, 13, Morris, 7, Ocean, 25, Passaic, 18, Somerset, 4, Sussex, 2, Union, 7, and Warren, 2. We are still gathering detail on 84 of the cases as to their county of origin. Our age ranges are confirmed as young as 3 to as high as 95 years of age. We do expect cases to continue to rise for some time, and we expect them to rise exponentially as we improve our testing. The social distancing measures we've been asking you to follow are critical to flatten the curve of COVID-19 cases. By flattening the curve, we're decompressing the peak of the outbreak and spreading the cases over time to conserve healthcare resources. The goal is to slow the spread of the virus so that fewer people need to seek treatment at any given time. The same number of people may get infected, but it will be over a longer period of time. We cannot emphasize enough how important it is to follow social distancing steps and practice good health habits. Stay home when you're sick. Wash hands frequently with soap and water for 20 seconds. Avoid contact with people who are sick. Cover coughs and sneezes. Avoid touching your eyes, your nose, and your mouth. And clean and disinfect frequently touched objects and surfaces. NJ211 continues to be a great resource for the public to get information. Since being activated yesterday, they have handled more than 400 calls for more than 8,000 people have opted into receiving information by text or telephone. This is in addition to the more than 8,500 calls handled by the call center since it opened. So please continue to use call or text to get updated information. We need to all work together to slow the spread of novel coronavirus. Thank you.
Judy, thank you. As I do my math here, I think we're now up to 19 of the 21 counties, Salem and Cumberland being the only exceptions so far.
And it will be in all. I just want everyone to know that.
Amen.
It will be in all.
And the numbers are going up, and they're going up meaningfully. And a big reason is we're going to be testing a lot more people. So, any more color, Chris or Judy, on the Bergen drive up? What the actual address is? Do you have to call ahead of time? Make an appointment? Do you need a doctor's permission slip? Any more color on that, if you could?
Certainly, Governor. The operations will be from 8 to 4 at Bergen County Community College. There will be no pre-registration required, and individuals are expected to come with identification to prove their residency.
And do they need to prove their symptoms?
To the extent possible. I mean, when they arrive, they will be screened for symptoms of fever, shortness of breath, or cough, and individuals who are otherwise asymptomatic will be turned away.
Okay. And I think we determined, I don't want to speak for you, we determined that was easier to deal with than making someone get a permission slip from a healthcare provider. Our technical folks will make an assessment on the spot.
That's correct. If individuals have a physician's order, please bring that. If you do not, you can still receive a specimen collection.
Okay, assuming you've got symptoms.
Assuming you are symptomatic, correct.
Got it. So this is not, I want to repeat this is not for the worried well. And we're giving, again, Judy again, and Chris and Christina, if I get this wrong, we're giving priority explicitly for healthcare workers.
For the two FEMA sites, the prioritization has been set up so that all specimens are prioritized for immediate transmittal to the laboratory for testing.
And we would expect Bergen County College is going to open at 8 a.m. tomorrow morning. We would hope and expect, and Pat Callahan can comment on this at some point further if need be. Again, I want to give FEMA Region 2 a shout out because they've helped us set this up. They're also helping us set up another site at the PNC Bank Arts Center in Holmdel, New Jersey, down in my county of Monmouth. So thank you for that. We can take any more questions in a bit. Thank you, Judy. Again, happy St. Joseph's. It's an honor to have somebody who's at the front line in a different respect with us today. We'd love to ask a dear friend and leading healthcare light in our state, the CEO of Hackensack Meridian Health, Bob Garrett, to say a few words. Bob, great to have you.
Thank you, Governor. Thanks for having me today. And I want to start by really commending the Governor for his leadership and the actions that you have taken, particularly on the mitigation strategies that really will make a difference for our healthcare system. And I want everybody to know the Governor has been checking in with myself and my colleagues around the state on a regular basis, which really gives us great comfort. He understands some of the activities going on the front lines, and also gives me an opportunity to share his best wishes with our frontline caregivers. So thank you for that, those reach outs. And I also want to commend the Commissioner for her efforts. The communication, the collaboration, the responsiveness have been amazing, and I could not think of a better person to be our health commissioner at this very, very difficult time. So thank you, Judith. I've been a healthcare leader for 35 years, although the last few weeks have felt like 35 years in themselves. But I have to say that I've never seen anything like this. This pandemic is by far the most disruptive force that I've ever seen in our healthcare system. We are literally engaged in a global war with the COVID-19 coronavirus. Healthcare workers, as the Governor said before, are on the front line of everything that's happening. They're truly our heroes here in New Jersey. We must understand that we're in this for the long haul. This will tax our clinical and human resources like we've never seen them tested before. In our network at Hackensack Meridian, which is New Jersey's largest with 17 hospitals, we have already seen 121 positive patients. 78 are currently at our hospitals as inpatients. We also have another 500 patients currently right now as I speak that are awaiting test results that very well could turn into positive COVID patients. At Hackensack University Medical Center, which is our flagship hospital alone, we have treated over 60 COVID-19 patients to date, and that number is growing. So I want to talk a moment about preparedness and potential challenges. There are extraordinary efforts underway in hospitals across New Jersey, and for that matter, across the nation, to fortify operations. Capacity issues will continue to be a problem, and that's not just in terms of total number of beds, it's also about ICU bed capacity as this crisis continues to grow. Health systems throughout New Jersey are postponing non-emergent surgery and procedures. Hackensack Meridian has also done the same. This is actually increasing our capacity by about 20%, so that's a significant move that the hospital systems have been making. And if you think about it, it allows us to redeploy staff, like, as an example, OR nurses that were in these surgery settings now can get redeployed to the emergency department or to an ICU or to a patient floor where they're needed to take care of patients. Hospital systems are working to coordinate resources and room availability. This is really important, as we all know, and we heard from both the governor and the commissioner, that we expect an increase of cases as more testing becomes available. When I spoke to one of our ER chiefs at one of our hospitals, he put it this way: all hands are in. We are prepared and laser focused. We are holding the line. So I want everybody to know the spirit at the front lines is still good, and people are determined to fight this common enemy. Beyond the heroes that are in scrubs, the command centers in hospitals across New Jersey have an army of experts that are working literally 24/7. Epidemiologists, internists, supply chain experts, and people coordinating closely with the Department of Health and the CDC. They are marshaling resources from hospital to hospital, updating staff on protective gear, and closely tracking cases and capacity. They're marshaling resources, as I said. It really comes down to this. In hospitals today, there are only two jobs: the people who are directly taking care of patients, and the rest of us who are taking care of those people. Our health systems in New Jersey are seeing staffing shortages due to the significant number of doctors and nurses being quarantined due to potential exposure. At Hackensack Meridian, as I speak to you now, there are about 150 healthcare professionals that are in a quarantine situation. Significant supply shortages are anticipated as well, including personal protective equipment and ventilators. I do applaud the President for his invoking of the Defense Production Act to ramp up manufacturing capacity. We need this national call to action to dramatically increase manufacturing capacity to provide the amount of PPE that are necessary to support our frontline team members. The decisions and investments that we're making today will absolutely save lives over the coming weeks as we see a steady rise in cases. I'd also like to commend the governor again for his efforts in New Jersey to flatten the curve and urge people to stay home as much as possible. That's going to make a huge difference in this crisis. If we can really flatten that curve and spread out the number of cases, we have a fighting chance. I've been in touch with professionals, healthcare professionals, doctors in China and in Italy, and it's heartbreaking to hear the stories, particularly in Italy, of what's happened when there was a huge surge of patients literally dying outside the doors of hospitals. We don't want that to happen in New Jersey, and I applaud you, Governor, for the actions you're taking to help us avoid that. I'm really heartened to hear that the Governor and Commissioner Persichilli announced yesterday that the state is working to bring 500 additional beds online. They will be needed. I've also received calls from heads of many of our colleges and universities offering their campus to support our efforts, which may include temporary housing for nurses that may be traveling from out of state that we're going to need to bring in to the state of New Jersey. It's also vital that we rapidly expand testing. We're gratified to hear today about the Bergen Community College and the PNC Art Center that will be opening soon, because that's going to be important to really collect specimens within our state. However, I must emphasize the need for better testing turnaround time from laboratories across the country. This is important because we can confirm and isolate patients as soon as possible, which limits the number of staff exposed and thereby allowing us to get more usage out of the limited supplies of personal protective gear. Our network, as you heard before, launched our own test, a combination, I think what I would call it the best of two worlds, a combination of the CDC test and a test that was developed in a laboratory in Germany that's been endorsed by the World Health Organization. We are testing on average 50 people a day, and we can have results very quickly, within 4 to 6 hours. Like many networks, we are contracting with several laboratories, national laboratories, to get more results and faster results. So in conclusion, with all of our challenges, I could not be more proud of our hospitals and our healthcare workers throughout the state of New Jersey. We'll continue to deliver for our communities, even in this unprecedented storm. Thank you, Governor.
Bob, thank you, and thank you for your remarks and your leadership of our biggest healthcare system, and we need you now more than ever before. So thank you for everything. I also want to thank our folks who are doing the sign language. I meant to thank you earlier, so I want to thank them for that. Again, Bergen County College, Community College, tomorrow, 8 a.m. to 4 p.m., day one. Lots B and C, 400 Paramus Road. Lots B and C in the parking lot, 400 Paramus Road. And tomorrow is day one. As I said, I don't want to marry myself to a day yet on Homedale and the PNC, but Pat, I think it's sooner than later. Is that fair to say?
That's correct, Governor.
Fantastic. Thank you all. And Bob, thank you again. We're going to switch gears mightily for a second. I want to applaud our Secretary of State, who has a lot of things, a lot of balls in the air right now. She and I and our teams had a conversation yesterday, the day before, about the census, which is upon us in the midst of this crisis. I mentioned, and certainly she oversees elections in our state. I mentioned some of the steps earlier that we are taking, and would love to ask our distinguished Secretary of State, Tahisha Way, to please give us a little bit more color on that. Tahisha, thank you for everything.
Okay, good afternoon, and thank you, Governor Murphy, Commissioner Persichilli, and Colonel Callahan. I am truly proud and grateful for your leadership during this challenging time. As the governor notes, I do oversee elections, the Division of Elections, which works closely with county and local election officials, our colleagues in state government, federal government partners like the Department of Homeland Security, and now the Centers for Disease Control, to ensure that voters, elections, and infrastructure are safe, whether from malicious actors, natural disasters, or emergency situations, including public health crises like the one New Jersey faces today. Make no mistake, COVID-19 is an unprecedented challenge, but we are fortunate to have the tools and teams at our disposal to protect public health and uphold our fundamental right to vote. Now, if I may take the opportunity to elaborate upon what the governor's executive order means for New Jersey's voters and our upcoming elections. First, as it relates to the upcoming March 30th deadline for accepting candidate and delegate petitions, we recognize the credible risk that canvassing for petition signatures poses to candidates, delegates, supporters, and voters alike. Therefore, to ensure fair access to democracy while also protecting public health and safety, the Division of Election, as our governor has noted, has created an online form to allow candidates to continue accepting petition signatures virtually. Now, this form and all of the respective instructions will be online at our website, and I do want to repeat it if I may, which is elections.nj.gov. Additionally, as noted, petitions will be accepted via email, fax, regular mail and by hand delivery, while we will still observe the appropriate social distancing. And do note that several of my election staff will routinely come in should the petitions get delivered by hand, in person, or even by mail, just to check on those. Secondly, at a time when certain voters, including the elderly and those with pre-existing conditions or chronic illnesses, are at particular risk for contracting COVID-19, we cannot allow them or any voter to have to make the choice between their personal well-being and moving democracy forward. Therefore, in order to provide state, county, and municipal election officials the time we need to ensure that every eligible New Jerseyan can vote, as the governor has also noted, several of the upcoming elections are postponed until May 12th. To repeat, the March 21st Fire District election in Old Bridge, the March 31st elections in West Armwell and Atlantic City, as well as the school board election scheduled for April 21st. Moreover, all elections, as stated, scheduled for May 12th will be